I looked at the email today. I had worked on it and cleaned old stuff out and thought I had it all done. And then I looked at it today, and there were several things, and I went, uh-oh, what's going on? And finally read the date, and it was over a year ago, so I thought we didn't need to discuss that. So, no new emails. Okay. I mean, that's great. That's what it is.
Sorry, I just received a message from someone on check, and they said that they're changing the meeting online because of you. So they didn't know if you had like a bad mic or something. I don't hear you here. If that one doesn't work, I can bring you up. That one sounds hot.
That was real good.
Okay, is that better? All right. So for the membership subcommittee, that is no more. With the new bylaws that were adopted by the board members will each appoint 2 parents, and then Dr. Knoll appoints 7 people. So at present, we have the document open for SHAC members that are interested in returning to let us know if you wanted to come back. The SHAC is no longer involved in the membership process per these new bylaws, so I don't have any other additional information about that process, and I don't know how the application that is currently out, I don't know how that's going to work. All I have is what is written on the screen.
Yeah, and I think what we're going to do is try to forward at least that information to the board members so they can review that and see who's interested, who would like to be on it, and hopefully that'll help with the selection process.
Okay. For the mental health subcommittee, Ms. Horton, do you want to? Oh, no, I see you. There you go.
Hello? Okay. Hi. So just a quick update. Through the Girls Academic Success Work Group, which is part of the Mental Health Subcommittee, we kind of ended up having an update from Project Mentor. And I know some people probably already know what that is, but some don't. And I just wanted to share really quickly. that we had an overview of Project Mentor, which is through the Conroe feeder. And I mean, right now it's only at the Conroe feeder. And there are currently 100 students on the wait list looking for a mentor there. And so just those of you that weren't aware of it, if you could, you know, go through share that with your networks and let them know that there are students in need of mentors in the district, and if they had time available to get involved with that on a volunteer basis. The website's there, conroeisd.net/organization/project-mentor. And if we can just get the word out on that, that would be great. It's a great program.
Thank you. Any questions? Earlier, oh, go ahead. Earlier when we talked about the compliance and recommending strategies for parental awareness, and then the suicide prevention toolkit, this is a portion of the compliance piece that the SHAC tackled this year. It's from 28004 that the SHAC was required to make recommendations to prevent mental health concerns. And so, so the SHAC worked on this toolkit, worked very closely with Lindsay and Dr. Taylor and all of the friends in the guidance and counseling department. So that's a pretty big accomplishment and collaboration of the SHAC and the district as well. So the toolkit makes it easier for campuses to raise suicide awareness. Is distributed, will be distributed, yes, both. District-wide to principals and guidance counselors, and then the information provided in the list is not exhaustive. It's just a plateau or a jumping off point for instructional purposes. Okay. Alternative and supplemental health curriculum has not met all year, but out of transparency, we just wanted to make sure everyone had an opportunity to comment. And then moving on, for the Triennial assessment information update, Mr. McCord. Oh.
Sorry. I'm going to fill in for him. Unfortunately, his father passed away yesterday afternoon. So,
oh my gosh.
So I'm going to step in here and do the best I can with the information. So first of all, the last meeting, our lead nurse, Barbara Robertson, gave a little overview of what the triennial assessment would be and the information that it would have. So what I'm going to do is kind of go through what the process was with the schools and share some of the results with you. So first of all, the wellness policy is as part of the United States Department of Agriculture, and it requires that if you receive funds from the federal government, that you conduct an annual or a triennial assessment. That was kind of covered the last time, so I'm going to skip through some of this because the rest of it gets a little more lengthy. As policy through the district, you have FFA legal and local that says that we would have a wellness policy in place that's written, and it includes methods to promote student wellness and prevent and reduce childhood obesity and provide assurance that school meals meet the federal guidelines. So what is the triennial assessment? It has to be performed once every 3 years to assess schools' compliance with the local school wellness policy and make assessment results available to the public. The assessment must measure the implementation of the local school wellness policy. And it includes the extent to which the schools under the jurisdiction of the district are in compliance. It looks at, are we meeting the district's wellness plan and policy compared to a model school. So there's several different groups that you can use, but they establish what a model school would look like, and then they compare you to that model school. And a description of progress made in attaining the goals of the school wellness policy. So it's looking at, are we making movement in achieving the policy. So once the triennial assessment is complete, the district must make updates and modifications to their wellness policy. So kind of go through the history of this real quick. Is back in 2017 we established the first wellness policy to follow, and so you didn't really do an assessment. You didn't have anything to assess. So they put together a plan of what a healthy environment would look like. In 2020, they were supposed to do the triennial assessment. However, I think we were a little busy in the spring of 2020 with COVID, and so there was a waiver placed and it postponed it for 1 year. And so then the district did the assessment a year later, and with everything that had been going on with COVID, health, and so on, it was a challenging, we were happy and thrilled, and everybody was excited that we had made it through COVID. We're the only area school district that didn't close down for any substantial time other than the spring of 2020. And so overall, we had felt like we had done a great job. So as this was being filled out, it was probably filled out with a lot of excitement and enthusiasm that we were where we were, because it was pretty much a great accomplishment for us. So now that leads us to 2024 spring, where the principals were a part of that process, and knowing the policies, procedures, and so on, and what the plan was. So in the triennial assessment, you had, there were different goals within the triennial assessment that you had to complete based off of our plan. And each goal has multiple questions to it that the principals answered. And they either answered it as fully implemented, partially implemented, under development, not implemented, or it didn't apply to them. And so a scoring guide was if it's fully implemented, it was a 3, 2 for most, 1 for some, and then 0 for none. And we'll look at some of the individual questions here in a second. They were shared the last time, but I know it was quick. So in the triennial assessment, we had 66 schools participate, which was everybody. We had 48 elementaries, 7 junior highs, 10 high schools, and that does include the 9th grade campuses, and then 1 virtual school. So this is goal number 1. The USDA nutrition standards will be used as a standard for guidelines pertaining to foods and beverages made available on school campuses. And the blue column are the 2020-2021 results. The green column is fully implemented. The orange column is partially, and under development is the tan. And then the white is not applicable. If you'll notice that white has 1.5%, you're going to see that often because that's the virtual school. Because if they're not at school, a lot of this stuff doesn't pertain because they're not serving food within the school. So each school represents about 1.5 percentage points. It gives you an idea. So then you had the different objectives under Goal 1, which were foods on campus sold comply with the state and federal laws and regulations with the dietary guidelines. This is largely controlled by our child nutrition, and so that is one that's fairly easy to hit. Please know there's going to be some variances in it because some of this goes also off of the knowledge of food and the guidelines that are put out there with smart snacks and so on by the campus principal or the people they consulted in filling this out. So some of that does vary, and we did check on some of the differences in some of the ratings to make sure we understood why they marked what they did. And I'll point a few of those out as we go. Food providers will take every measure to ensure that students have access to food and beverage that meet the laws and regulations and guidelines. Food providers will offer a variety of age-appropriate healthy food and beverages in EC pre-K elementary schools, middle schools, and high schools. And so for the most part, everybody put that it's fully implemented. Just a little over half, a little under half were in process. The schools will comply with federal Smart Snack guidelines, and you'll see a 34%. So we're like, okay, what's going on there real quick? Well, very interesting that you get over to the comments and it says some snacks provided by parents of PTO do not meet Smart Snack guidelines. One of the big ones is towards the bottom is the state came in. At one point it had said that you can't bring anything in for birthday parties or anything like that anymore. Well, then they reversed that out. And so if cupcakes are brought in for a birthday, those don't meet the Smart Snack guidelines. So a lot of our elementaries were marking that it was partially implemented but not fully implemented because of cupcakes and stuff for birthdays. And but that was something that the state and felt that we needed to still have in our schools. Snacks during the school day comply with federal Smart Snack guidelines, and that comes under some of the same things of teachers trying to make sure that they meet the SMART guidelines, but they're also trying to do some rewards to encourage kids for participation and performance. Schools will provide and promote nutrition education to students and staff. And so number 1A is schools will provide nutrition education and engage in nutritional promotion. That is an area, and this is kind of one that we, as we talked and debriefed a little bit about the results, was a lot of this goal is going to be related to a lot of communication, that we can look at how we're going to communicate not only within the schools, but then also communicate out to parents in our community through newsletters, social media, webpage, and so on, to try to get more information out there about good, healthy nutrition. Campus's coordinated school health team, and it lists the members of that. Coordinated school health team will promote campus wellness education and school-wide activities. And I will say, coming out of COVID, getting those teams operational and back up and going has been just a feat, and we're working on that piece. Nutrition education will be acquired and research-based sources, and it lists the different sources that we would utilize. And we see a lot, the resources we have are meeting the guidelines from the campuses that responded. Nutrition education will be increased by sharing information with families and the community via the CISD Child Nutrition Department website, monthly newsletters, and so on. I've already addressed that, of kind of the plan of getting more information out. After school activities may encourage and include physical activity along with health and wellness information. Once again, that's communicating and encouraging and getting information out to parents as well about opportunities they have to participate. Our goal number 2, all foods made available on campus will adhere to food and safety security guidelines. All foods made available on campus comply with the federal and state guidelines and the critical control points. This was one that we were a little unsure of why it was, because this directly, and Robin, tell me if I'm wrong, but this is the one that is directly related to the cafeteria workers, correct? So they follow 100% all of the rules, guidelines, and safe serve and all of that meet. So some of this, if the principal's filling it out, they don't necessarily always know. Some of the comments that we think that we have received back from some principals was if the PTO was there serving something to the kids in a classroom, were they using gloves or not gloves as part of that? And we believe some of that is the response of the 36%. Campuses promote and demonstrate appropriate hand washing practices. As we know, that was huge in COVID and coming out of COVID. We've had signs up and a lot of things up there, but it's probably time to come back and refresh that and also serve as good reminders. Access to the food service operations are limited to child nutrition. We were a little confused by that because you have administrators that are approved people to go back there if necessary, and that was some of the responses we got, that they were able to walk back there. Well, you're supposed to be able to walk back there. You're the administrator in charge of all of it. So, like I said, some of it is a little education. District administrators by area of responsibility are responsible for ensuring local, state, and federal laws, regulations, and guidelines are updated and in place. We're moving in almost 100% across the board. District safety, health, and security policies and crisis plans are current. Training and communications is provided to staff, students, and the community. Once again, this is more information being communicated out there to our communities. Schools will provide opportunities for students to participate in regular physical activity which promotes personal healthy lifestyles. And goal 1 was schools will provide opportunities for students to participate in regular physical activity which promotes healthy lifestyles. The physical activity shall not be used as a reward or punishment. So you'll see that is split. And we do not use the physical activity for punishment, as you can see in the comments. If they do well or perform well or work real hard on something, then they do rewards of extra recess or extra time to get some of that physical activity going out there. But as one of the comments was that physical activity is never used as a punishment. It's usually a student choice reward to encourage and to help them. Opportunities for physical activity outside the classroom and or school day are encouraged. I think they're encouraged pretty well, but that's something with communication and making sure everybody's aware of opportunities. And daily recess break of 30 minutes for elementary students, and that was answered 100% of our pre-K 4 kids have that 30 minutes of recess. Goal 2, schools will provide opportunities for every student to develop the knowledge and skills of specific physical activities in accordance with district, state, and national guidelines. So 2A was one that we had to call and ask about, but we have state certified physical education instructors will teach all physical education classes. Well, Conroe ISD, everybody has to be certified. So we called those principals, and you do have teachers that are alternative certified, and the principals were unsure if they counted as a certified teacher or not, so they went more cautiously not, but they are certified teachers in the classroom. So they do meet the standards, and that was all 3 of those that responded. Strive towards physical education classes to have student-adult ratio not to exceed 45 to 1. If the ratio is greater than 45 to 1, then CISD must provide protocols in which to safely will maintain for all students. Safety is maintained for all students. You'll see at 97%. You do have some schools out there with still the gym and cafeteria combo that in some of our larger elementary schools create that issue. But as we know with the last bond, we are working on that to resolve that problem with individual gyms. The K-6 grade students have a minimum of 30 minutes of moderate and vigorous physical activity daily, or 135 minutes a week. You had 68.8 elementary intermediate and 31.2. And it goes with the gym space as well, and making sure that they can provide that. If you look at the comment, it's that they are able to provide 130 minutes, not the 135. so they're very close at where we needed to be. 7th and 8th grade students shall have a minimum of 30 minutes of moderate and vigorous physical activity, or 135 minutes weekly, or 225 minutes over a 2-week period. And you're going to see the percentage is a little bit lower, but remember that it changed in what the requirements are for 7th and 8th grade. You're required a full year of activity for 7th grade and only a half a year for 8th grade. So that does impact that tremendously, because they are not getting that through both 7th and 8th grade as the goal was. Time allotted for physical activity will be consistent with national and state standards, and that is the goal that we're working towards. All physical education instructors must be certified in CPR, AED, and American Red Cross or another provider, and we're at 100% of that. The school environment is safe, comfortable, and promotes healthy eating practices. Number one, we have dining areas are clean, attractive, while providing enough seating for all students during all meal times. You will see an anomaly out there. One school said that they partially implemented that. We called that school. It's a full school. It's not overly crowded as some of the others, but that was their comment is they're full. They have a lot of students, but everybody has a place to sit, and everybody was okay, but they were being cautious in how they filled it out. But we did talk to that principal just to make sure. And we didn't adjust any data or anything like that. We wanted to understand what they meant so we could answer a question like that a little bit better. Food is not used as a reward or punishment for student behavior unless it is detailed in a student's IEP. Once again, using food as a reward is a common practice, but is not used as a punishment. So we're not taking away food from a kid. As required by IEPs, 504 plans, or food management plans, allergy-safe areas are available for students with food allergies. And you'll see, for the most part, we're compliant there. It becomes tricky as you're trying to not identify any of the students with any of the allergies. So trying to create that atmosphere where they're comfortable going and sitting with some friends and not singling them out is the challenging part, but everybody has some plans to make that work. School-based marketing for food and beverage products are consistent with Smart Snack guidelines and aligned with the federal and state and local regulations laws at 89%. We have school nurse provides expertise and oversight for the provision of the school health services using clinical knowledge and judgment. The school nurse provides health care to students, performs health screenings, and coordinates referrals to healthcare providers. The school nurse also serves as a liaison between school, personnel, family, community, and health care. And you'll see a little bit just that anomaly again. And you have some brand new school nurses that come in, and some are able to handle it very well. They've been a school nurse before, but a brand new school nurse, it's different. It's a different kind of nursing. And so some of it is just experience, and they're getting there. District policies support personnel efforts by employees to maintain a healthy lifestyle, and that is always, I got something the other day on all of that, so we do a pretty good job on that. Adequate time and space allowed for eating meals, and this goes with, are they giving the appropriate amount of time recommended to eat? And you see 95%, 97%, 97%. So we're doing real well on that. As we know, we do have some crowded schools, and that is being alleviated by the new schools that were passed in the bond. The deputy superintendent will monitor each school for compliance with the Conroe ISD wellness policy, and you can see how Dr. Medford responded as partially implemented, and as you see, that matches a large percentage of the data. and it's looking at the compliance pieces of that. Public notification: the Deputy Superintendent representing the School's Health Advisory Council shall report directly to the CISD School Board at least once annually, including a written report with information regarding the Council's recommendations for considerations towards future district policy. So we will be working on in the fall a new policy, a new health policy that the health services and our health department will be working on and bringing to the SHAC for input and recommendations and so on through the process.
I answered partially because I'm literal, and it said that I reported directly, and I didn't do it, so that's why I put partially. Dr. Upshaw and Dr. Streeter did, and so I'm just a very literal person, so when I answered it, I'm like, that's doing partially because he did report it, it just wasn't me.
Right.
I'm sorry, what?
But welcome to my brain.
No, what did we report?
The like annual.
The triennial report.
Yeah, we didn't report that.
Well, we do have the recommendations for considerations. We did policies, we did cell phones, like that's where I like overanalyzed. We did once annually, we included written reports and information, right, towards consideration for future policy. I answered it as this health one, but it's like that's why I said partially. So it was kind of, I felt like it was a little bit of a weird.
Right. There were some policies that were being presented through SHAC that throughout the year. Well, the cell phone for mental health.
But that's not what we're talking about. We're talking about the triennial assessment, right?
Right, but within here, I felt like there were different things within here that I wasn't quite sure, so that's why I didn't say that it was fully, like, it was. Yeah.
So you'll notice in some of the goals, not only in some of these and some of the others, you know, until you get a lot of feedback from principals on answering the questions, there were some that as we do the new health plan, we're going to have to rewrite the questions to be more specific or more targeted to what we're asking, because we found that it left some too much. You had to have too much knowledge of other things. We were assuming a lot and not getting to the specific details. So we're going to have to rewrite some of that, but part of that is rewriting our plan and then rewriting the questions to match and assess and evaluate our plan more effectively. Does that make sense?
I'm just going to go on record for, I have no recollection of any reports going to the board about any triennial assessment in the time I've been on the SHAC. So.
Okay.
Just so you know, I wasn't saying about the triennial assessment. I was talking about in general, like we're assessing over the last few years what has happened, and since I was new, I was unsure, and so that's why I just wanted the SHAC to know why I answered it the way I did. Because I do know we've made several recommendations to the board with policies, and I didn't want anyone to feel like I wasn't representing the fact that what the work the SHAC has done over the years. So we can add that to the notes to make sure that it's clear. So.
And this is one that goal 1, as you read, it talks about what the SHAC has done, not specifically in the, even though this is under the triennial assessment and a question in that, it's not asking if that report on the triennial assessment was done. It's just what did the SHAC do? And so I think that's what she was saying. So if you answer the question, the questions would be partially implemented. If it had the phrase in their triennial assessment report was done, then it might have been answered differently. Triennial assessment, and this is kind of a breakdown of a percentage of campus objectives. We had 60%, or 22 of the 33 objectives were fully implemented. So we felt that from what we felt like was probably the first most legitimate and authentic assessment because of the 21 and when it was done at the tail end of the dealing with COVID and kids being out and not at school was a pretty good target. So moved from partially to fully implemented. These are the goals that were originally marked partially to fully implemented. I'll leave those up for a second if you want to look at those. Okay, are we good? The areas of decline, the wellness goals, all foods made available on campus will adhere to the food and safety guidelines. That's the one we had a school mark that, or a couple of schools marked that they were unsure about that, but it was still a decline because we didn't go back and correct after we found more information. We wanted it to be, the scores were the scores. That's how they marked it. That's what they understood. And so that's how they marked it. And then the full physical activity, and this related to the mainly the 7th and 8th, and then some of the 5, 6 campuses with time on physical activity, the 130 minutes instead of the 135. Oh, that was, I was looking over my shoulder. And then, so now we're going to look at the triennial assessment and the WellStat. So schools have options of what they pick to look at to evaluate their plan and how the plan looks in multiple ways. The district chose WellStat, which is the one that is recommended. And so we're going to take a look at how that looks. And the WellStat, if you scored a 0 or a 2, a 0 is the lowest, and it's the item is not mentioned in your wellness policy or wellness plan. A 1 is the wellness policy or wellness plan mentions vague and or suggested strategies. Or 2 is the highest, and it's the wellness policy or wellness plan addresses the specific the item with specific, clear, and detailed actions. So you have comprehensive scores of a 1 and 2, and so you give a strength score and a comprehensive score. So it gives some examples here. For example, addresses the amount of seat time students have to eat school meals. If you didn't put that in your plan, it would get a 0. If you had it in your plan, and schools are encouraged to permit a full day students a lunch period of not less than 20 minutes, would be a 1, and it's not detailed enough. And then a 2 would be after obtaining food, students would have at least 20 minutes to eat lunch, so it's a lot more specific. And so that's how you go through and evaluate in the WellStat. So you take the feedback from your assessment and evaluation, and there were independent people that sat there and went through all of that data and scored the WellSat, and then they took all of their WellSats and looked at them and reviewed them to make sure that they were as accurate as possible with scoring this assessment. This is the WellSat. You will see the blue bars are the comprehensiveness of our plan, and the yellow bars or gold bars are the strength of our plan. And remember, when you look at WellStat, this is comparing it to what they consider the model school. So you have to take that with what it is. For example, there's choices you make within a plan, and the choices you make within a school district's plan may not match up to all of the WellStat questions that they have for you as well. And Dana, I know you were part of that. If you have anything you would like to talk about on WellStat.
Can you hear me? Is it on? One thing I would just mention is that WellSat it really compared to that model program. And so some of the things did not match up as we went through because there's national standards that were marked in the WellSAT where we have state standards that we would comply with, such as PE minutes and such. So some things didn't match because of that. That makes sense.
Yeah, so some of the laws are not the same across federal and state. So if we follow the state, then we don't meet it another one.
But it
or vice
was a
versa.
very eye-opening and helpful tool to be able to see with what is our current plan and how could it be enhanced to be more easy to track and easy to implement.
So are the standards for the state lower than the federal standards, or are we exceeding federal standards as compared to what the state of Texas requires?
On PE minutes?
On whatever you were talking about.
PE minutes
Yeah.
is what came to mind, and I don't have it in front of me to be able to tell you what it was, but I know it was different.
It's not a trick question, but my understanding is the national guidelines for PE minutes, we are not meeting those in our district or at the state. Like the disparity between what the state asks and what nationally is recommended, that we're not there. So the reason I asked for clarification is that my assumption is that if we did not meet the standard and the two standards are different, then if the Texas standard was greater than that of the federal standard, then we would have met both. So if we didn't, then our
Right.
standard must be lower, no?
Right.
Okay.
No, I would agree with that.
Okay.
So the state standard, if this is set on an ideal school, WellStat is set on an ideal school using the federal guidelines. Is that correct, Dana? Does that make sense?
Yeah, so the model policy or model plan that it matches you up to is the national guidelines. So
So
some
if-
of them weren't applicable to us, right?
So remember, there would be multiple things that have to happen when you score the WellSat. So first of all, your evaluation, your assessment, your wellness plan has to have all of those WellSat items in it. If it's not even mentioned in there, then it's an automatic 0. And so there were some things that were not in our wellness plan that were in the WellSat. So that's an automatic 0 points. Does that make sense? Then there are some things that are in our wellness plan meet the state guidelines, but necessarily not the WellStat guidelines. So that may receive a partial, a 1 because we had it mentioned, but it wasn't specific enough or didn't meet that level. And then you have which would get you a 1, and then a 2 would be obtained if you meet the WellStat guidelines. Does that make sense? So there are some things just by choice, because of the target of the wellness plan that you're trying to focus in on and raise up, that you might not hit all of the objectives that are in WellStat. So these are some of the nutrition education, section 1, and includes the goals of nutrition education that are designed to promote wellness. And you can see our rating that we scored ourselves based off of several independent graders of the feedback and information and knowledge that they have. So we had a comprehensive score of an 88, but a strength score of a 13. So the goal obviously is to get all of these to 2s if possible. So are there things to work on? Yes. Can we get better? Yes. Something to understand about WellSat is that, and participation in all of this is it's not a punitive thing. It's not to go, well, y'all aren't doing a very good job or whatever. It is to give you feedback and information of what that model school looks like, so then you can evaluate where you are in your plans and what you need to do to get better as a school. There may be some objectives that are on WellSat that when we look at our district, we're doing a great job doing. We may not put it in our plan, but we're doing a great job that may not be reflected on WellSat as well. And that may be something we want to look at, is making sure we do include those. But a lot of it is you're trying to improve and increase. If you're already at the top end, you sometimes eliminate those goals.
I was going to add, I think it's important to see that the WellSat is to strengthen the plan. And so it's not looking at the results that came in this spring, it's looking at the plan itself and how can we make that a stronger plan for the district.
So standard 2, standards for USDA child nutrition programs and school meals. You will see a mix of 1s, 0s, and 2s for a 50 comprehensive score and a 20 for the strength score. We have the Section 3 nutrition standards for competitive and other food and beverages. On how it's addressed in the plan, comprehensive and strength score, we're a 62 and a 46. So we do some things real good in this area, and there's some things that we need to address or make sure are in our plan, or educate and make sure everybody understands. Because some of what we saw in our plan was education of everybody over not doing. Section 4, physical education and physical activity. You see lots of 1s and 2s, some 0s in there as well, 63 and a 31. And this is looking at all the guidelines with how you're addressing the topics. And you'll see in there that it's, are you meeting the address qualifications for PE education teachers? So we were clear, it was very clear, very specific. If we look at a 0, addresses time per week for physical education instruction for all high school students. Well, my guess that was not in the plan. We didn't address that. That's why it was a 0. So kind of give some examples of what we're talking about as we go. Section 5, wellness promotion and marketing. You'll see some similarities if you look through that, but a comprehensive score of a 50 and a strength score of 25. Everybody time to look if they want. Trying to look at where heads are.
Dr. Merle, will this be on the SHAC website, or where can we?
It will if
Yeah.
I read everything correctly,
Okay.
making sure I'll want to double check. But the evaluation plus then the individual, if I read it right, the individual scores of the schools I believe go out there as well.
Okay. All right. Thank you.
Implementation, evaluation, and communication, probably one of our stronger ones, with a bunch of 1s and 2s. So comprehensive, we had a good plan. The strength of it, can we get more detailed in how we're going to do things and address different concepts and get that information out to the public, and communication we just need to improve on. And if you look at that, the questions that WellSAT covers, you'll definitely see, and it'd be in that with the PE minutes. It's how strong and how detailed were you in your plan over, are you meeting those guidelines we talked about. So the triennial assessment, make appropriate updates or modifications at the local school wellness policy. So that will be the next thing, as I discussed at the beginning, is the anticipated timeline is at the fall of 24. The SHAC meeting, the district will provide SHAC with recommendations to consider, and everybody will look at the plan, provide feedback, information, work on this, and then the SHAC will be tasked with reviewing the district's triennial assessment data and recommendations to work to. And so we'll end up providing the district's new wellness plan for the board to review and adopt. Any questions about the wellness plan? So that was about as short as it can be, I think.
I have a question. How is adequate time determined for lunch? What's where does that standard
So that's going to be one of those things that you'll see on the WellSAT, and that's exactly what we're talking about. It's not specific enough.
Okay.
What is adequate? That's some of the questions that, some of the questions that we were looking at when we saw some of the results, and we started analyzing and looking at why did people answer that way, is what is adequate. Why did for example, 40% say partially and 60% say fully, and it's because of the vagueness of the question. So we've got to that's where the WellSAT helps, is identify the question we thought might have been good when we created it, that when we put it in our evaluation and the objective in the wellness plan was not descriptive enough or specific enough. Does that make sense? So that's some of the improvement is we probably were doing, we are hopeful that we were doing better than some of the results, but it was communication and education of everybody in the district that was completing this and working on this and making sure they understand, like I explained on the one on a alternative certification teacher and their certification and how that counts. Well, that's just an education or an understanding information piece that would have made that 100% instead of 98.5. So those are some things that we've got to tighten up and make sure. You know, for example, on that one, you could say are all a certified teacher, and you could put in parentheses what the different certifications, what meets that certification, to further help that the principal or whoever's filling it out be more accurate.
Okay, so there's not a reference for a specific quantity of time that needs to be met at lunches to be considered adequate.
No, so in the plan and in the assessment, it was from once they receive their food, a minimum of 20 minutes.
Oh, okay, okay.
That was in
Got
there.
it.
And Dana, jump in because I'm going off of some memory here, but I believe that was right, or
You're correct,
or
yes.
Robin.
Yes.
Yeah, so that's the goal. That was what was
Okay.
in the plan. That was actually specific. So that was one area that we had a 2 on, I believe, on the WellSAT, because we were that specific. From when, and the difference was, as we said, from when they get their food till the end of lunch,
Yeah.
they at least have 20 minutes. Not from
Start to
big
stop.
start to
Yeah.
stop.
Yeah.
It's once they get their food.
Got it. Okay, thank you.
Any other questions? All right, so there's more to come, a lot of work to do on this, but I know Robin and Barbara and Dana are putting a lot of work into looking at this information and looking at our plan, and we'll start helping work on that plan to bring some information, more information to us so we can make good decisions going forward. All right, thank you.
Sorry, I just have a comment. I think it's good that they're looking into ways to improve for like wellness as well as nutrition. I mean, if you think about it, most of these kids eat 2 out of their 3 meals. For certain families, low-income families, they eat 2 out of their 3 meals of the day, or for some families, it's like the main food that they get, you know? And so making sure it meets, you know, standards and guidelines, because there's definitely an obesity epidemic in kids, and guidelines have changed in terms of how they take care of kids now when we assess them for their wellness visits because of this issue. So I think looking at it is relevant because they spend such a significant amount of time in school.
Yes, I agree. I think we're going to see a better wellness plan come out of this because we have better data. So you had a good plan. You had a plan in place. The first evaluation of it, you had a lot going on in this world, so it probably wasn't as accurate as we had hoped. And now we have better data. It's going to hopefully result in a better plan and help our kids and our community be better at physical activity and healthy eating.
Any other comments?
Even bigger than that. I mean, we have high fructose corn syrup in almost everything. You know, and that's the nation has high fructose corn syrup in almost everything, and that is one of the leading causes of obesity. Is it turns off your thing in your brain saying you're full, and you know, a lot of countries that's illegal to have that in your food. But so I mean, it's higher than CISD that needs to be fixed.
All right, the next agenda item is the district curriculum review for 3908, and Mrs. Taylor will be doing that.
Can y'all hear me? Oh, good, it's working. I do want to apologize for not being here at the last meeting, but I did get to watch the last shack. And so just kind of wanted to share a little bit about some information that was shared regarding suicide prevention. I know one of the things that the new House Bill 3908 talks about is the suicide prevention and also the awareness of local and school and community resources for our students and educating them in that. So part of it is some of the resources we shared align with our positive character traits. So when you look at prevention measures with suicide and really substance use and the mental health challenges, you're looking at helping with developing coping skills, problem solving skills, that strong sense of self-esteem. And so part of what we have are those positive character traits education, which talks about like the relationship skills, understanding empathy, reaching out for support and help, which kind of aligns with, or it does align with those protective and preventative factors. But that's just a small piece of what we're putting together. We do have the Are You OK information, which is a suicide prevention PowerPoint that is something that goes through kind of those preventative measures. It talks about a little bit about being sad and how to reach out and support friends. We also have our health teaks, which discuss suicide risk and suicide protective factors, as well as the prevention resources that are available. Are You OK also we have stickers in schools that list out those resources as well as what's required on the backs of the IDs for students as well. And so on top of that, just with the CATCH program, we'll have the suicide component in that as well. I know 6th grade was a little bit concerning with the kind of terminology used. So Are You OK has a little bit softer version or verbiage kind of addressing the suicide prevention with our students. So do y'all have any questions on that information? I think y'all got a chance to see it, correct? Okay.
Thanks. The next agenda item is SHAC bylaws update and questions. Tomorrow.
And I think Dr. Spear opened up the meeting early on and kind of updated everybody on membership and all of that, but we did want to put this on the agenda, so if anybody had any questions or follow-ups or anything you would like to know, we'll do our best to answer. We didn't put the bylaws into place, but I'll give it my best shot if anybody has any questions. Okay.
Well, I just had a question. If that, like, moving forward, I mean, maybe you may not know the answer to that question, but we're now at the end of this year, and so we're moving into the next year. So where are we moving forward from here?
That's where we kept, and we talked a little bit, and I talked to Dr. Spear briefly about this, was keeping the membership portal open so people could sign up if they were interested, because that became a question of, do we keep it open, do we close it? But we kind of made the decision to let's keep it open and let's see who signs up, and then that's just information we can give the board. And even we can look at that information and see if, we can always make a recommendation. They just don't have to take a recommendation, but we can make a recommendation of people, or making sure, or help analyze the data for them of the different parents and different feeders and so on, and people that have served on SHAC, people haven't served on SHAC, and who's interested, to try to help narrow that choice down to something that would be a productive committee. So that was kind of our thought process in that. It's just, in the end, a board member might say, I have 2 people I want on there, and they're not on a list, they're not signed up, and they can make that decision. the way the bylaws are written at this point.
The recommendations that we took, I sent back from our last SHAC meeting to Ms. Gladys, that there was no changes from the original version that we sent out to the SHAC, and then the discussion, all of the recommendations, not one was implemented. The bylaws are just the exact same as they were when they were written by Ms. Gladys. The membership part of it, as I mentioned, would be is 21 members. If you recall, last year we had recommended 31, and then the board increased it to 48 because their concern was that they don't turn any parents away. And the way the new bylaws have been written, it limits it to 14 parents. So the hypocrisy is quite real. And I just want to tell you guys I've really enjoyed working with you, and I'm really, really proud of what we've done. I mean, we have done more in 2 years on the SHAC than the 5 previous years, and that's a testament to all of the hard work and the hours that have been put in by all the volunteers sitting around this table. So you should all be commended. It's excellent.
And I want to reiterate that. Thank y'all very much. We don't know what this committee's going to look like in the fall, but I want to thank everybody for their participation. I've learned a lot about SHAC over the course of the year, and I know it's helped me a bunch. And the things that have come through this committee have been very, very positive things and positive changes for our kids. So thank y'all for your time and efforts on the committee.
All right. Well, on that note, if there's no more comments, I'll call to adjourn the meeting. Have a motion to adjourn?
So moved.
Second, and all in favor. Thank you guys. Have a great summer.